A certified natural medical practitioner based in London, in the UK. This is a very short presentation regarding low stomach acid and the symptoms, how you identify if you have a low stomach acid and what it means to you. In general, people complain that they have a lot of acid. When they go to the hospital, they're told that there's too much acid, so they're given anti-acid. But this is not true. With age, we rather have low acid. The production of acid by the stomach walls, it's reduced. And so we rather have low stomach acid. And the low stomach acid has real consequences. And so we should rather find ways to increase the stomach acid. The human requirements for vitamins, minerals, and other nutrients remain relatively constant throughout adult life. Unfortunately, our ability to properly digest food and absorb vital nutrients decline with advancing age. Surprisingly, one of the most common age-related causes of impaired digestive function is the reduction of hydrochloric acid produced by the stomach. So the condition of low stomach acid is what we term it as hypochlorhydria. But we are not here for big terms. So if you have a low stomach acid, normally you can't digest your food well. You can't absorb your essential nutrients like protein, minerals, and iron. And because of this, with time, you could have a real health problems. And how do you identify that you have a low stomach acid? Let's have a look at the following symptoms to identify that you have a low stomach acid. When you eat, after eating, normally you feel bloated and then also burping and the upset stomach. You don't feel comfortable after eating. You feel heavy, that heaviness. And then sometimes there's a sort of a nausea. When taking any vitamins or supplements, you feel, nauseated, you feel like vomiting. And then also there's a degree of heartburns. And the heartburns, it doesn't really mean that you have too much acid, so the acid is coming out. But rather, if the amount of acid in the stomach is less or is diluted, the valve covering the stomach is slightly open, so you have a little bit acid climbing up to the food pipe that is towards your chest region. So you have that heartburn or pain there. Low stomach acid symptom can also be diarrhea and gas, and then also desire to eat when not hungry. Even you don't feel hungry and you still have the desire to eat. Indigestion is also very clear symptom. So after eating, normally you feel that the food is still there. It takes longer time for your system to digest your food. So there will be this gas and then also heaviness. When it goes on with time, that individual may be losing hair, and the hair will be thin, that's a thin hair and light hair. So most women will go to the hairdressers for creams and so on, but not knowing that you have a low stomach acid, or possibly the liver is also not working well. You may also identify or see undigested food in the stew. So it's really important for us to be checking the stew. After some time, we should be checking that. That individual may also see that the fingernails are weak and brittle. It's also low stomach acid. And then fatigue because you're not absorbing your nutrients well, and that is not helping actually to get that energy that you require. There's also common or frequent gastrointestinal infections is also very common as well. The individual may definitely have iron, will be deficient in iron, so that person will be anemic, and then because of that, the anemic condition also may feel weak, especially when going by stairs or when you do anything that physically demanding. when we move on, we also see that that individual may go to the hospital and may do a blood test and may be told that his or her vitamin B12 level has gone down. So there'll be a deficiency of a very important vitamin like B12, which is so important for our nervous system, for the nerve health. And if your nervous system is weak or is affected, it affects your coordination, it affects even the digestive system, it affects how your muscles actually work, it affects even your heart. So that individual may experience, neurological issues like numbness, tingling, the pins and needles. That individual may also experience that vision changes. The individual may also see what they call the dilated capillaries in the cheeks and nose. So, because if you're in a dark or person of a color, you may not be able to identify that. Only a white person may identify this dilated capillaries in the cheeks and nose. Well, this is about low stomach acid and the symptoms. If you're interested in more information, please go to Dr. James. That'll go to YouTube, subscribe, and put in Dr. James dash natural link and subscribe. And please, you will always get us short, beautiful presentations to empower yourself through knowledge. So you're listening to Dr. James. I put my number down so you can also give me a call if you wish to talk to me. The number calling outside the UK is +44 738 464 7300. Thank you very much for listening, and please share to be empowered through